Hello and welcome. My name is Miss Milka. I'm a psychiatric mental health nurse practitioner currently practicing in Texas. I wanted to discuss about how we diagnose depression. So what is depression? Depression is a complex mental health condition. It's one of the mostly diagnosed conditions in the clinics today, and it's caused by various factors, which can include biological factors, psychological factors, genetic factors, and environmental factors. So, how do we diagnose depression? So, when you see a provider, it can be a healthcare medical doctor, it can be a psychologist, it can be a psychiatric nurse practitioner, it can be a psychiatrist, and how we diagnose depression is by conducting what we call an initial evaluation. If it's a psychiatric or a psychiatric mental health nurse practitioner that is conducting the assessment, we call it initial psychiatric mental health evaluation. And during this evaluation, we will collect information from the patient, and we can also collect the information from friends or family, which we call collateral information. With the mental health condition, currently we don't have a single test that we do to diagnose mental health condition. And the reason is because, and what I'm talking about, I'll give an example. If we have somebody has a medical condition, let's say they have high blood pressure, hypertension, and they come in and they see a medical doctor, the medical doctor will be able to check their blood pressure, and they collect what we call objective data. Objective data is data that you collect, and you're able to observe it. So they are able to collect objective data of the blood pressure, and they're able to tell, is the blood pressure normal range? Is it low? Is it high? If somebody has pneumonia, a medical doctor or a medical family nurse practitioner, they are able to do an x-ray, and they can be able to check on the results of the x-ray, and they can tell this person has pneumonia. If somebody has cancer, a medical professional is able to order a biopsy, so they can be able to do a biopsy, and they can be able to tell that the cells are cancerous. So with psychiatric condition, we don't have tests that we can carry out to get objective data. So we use subjective data, which is what the information, what the patient is telling us, or the family or the friends are telling us. So that's all that we use to diagnose depression. So we carry out what we call initial psychiatric evaluation. And when we do an evaluation, we interview the patient. They might allow their family, they might allow a friend to be in the room. And so when we interview the patient, we will ask them about their psychiatric history. So we'll ask them, have you been diagnosed with any other mental health condition in the past? And then we can ask about their medical history. So what kind of medical history do you have? Do you have hypertension? Do you have diabetes? Do you have heart conditions? And then we, we can use assessment tools. These are questionnaires. We have different questionnaires that we use, and these tools are able to give us, they're able to assess what kind of symptoms the patient is having. So I've talked about the symptoms of depression in the past, but I'll repeat them here again. So the symptoms of depression include lack of interest in things that one enjoys to do. There is sadness. There is changes in sleep. So somebody might sleep too much, what we call hypersomnia, or they might have problems with sleep where they're taking too long to fall asleep, or they're waking up in the middle of the night or not able to fall back asleep, or they're waking very early in the morning and they cannot fall back asleep. or they're not having sleep at all. And or somebody can have changes in appetite. This will be increased appetite, so they are eating more than they usually do, and they're gaining weight. Or they might have decreased appetite, where they are eating less than they usually do, they are skipping meals, and they are losing weight. Another symptoms of depression is feeling hopelessness and helplessness. Another symptom of depression is feeling worthless and guilt. Another symptom of depression is feeling bad about yourself, and also lack of energy and fatigue. So they might feel fatigued throughout the day and lack energy, or they might have difficulty focusing or concentrating, or they might have thoughts of suicide. They might wish they were dead than alive. They might start planning of suicide. Uh, so those are the symptoms that we have for depression. So when we use assessment tools, and like I said, it's questionnaires that we will give the patient to fill out, and we are asking them, have you been feeling sad? Is it that you haven't, not at all, you haven't been feeling sad at all? Is it how many days per week have you been consistently feeling sick, feeling sad? And how severe has it been? Then we ask, what about appetite? Have you been having decreased appetite? Have you been having increased appetite? And they will rate the severity. So we'll know, is it mild? Is it moderate? Is it severe? And also sleep. Are they lacking sleep 7 days out of 7 in a week? Is it 3 days in a week? Are they having, how many hours of sleep are they getting per day? Are they getting maybe 4 hours of sleep? Are they sleeping too much and sleeping maybe more than 12 hours a day? What about fatigue? Are they experiencing fatigue throughout the day? They feel like they don't have energy throughout the day. What about thoughts of suicide? Have they had any thoughts of suicide? Is it every day they're having thoughts of suicide? Are they wishing to be dead than alive? How do they feel about themselves? Do they feel bad about themselves? Do they feel worthless? Do they feel guilt? Do they have guilt? Um, so these are kind of the questionnaires will ask these kind of questions, and it will also give us how severe are these symptoms, so that we'll use this to diagnose depression. And then we will use a diagnostic criteria. So we'll use a diagnostic guide to be able to see, does this patient meet the criteria for depression? And then for medical history, some medical conditions can mimic depression. Like if you have thyroid issues, you have hypothyroidism, you can have symptoms of depression. So a medical professional, a psychiatric professional or a medical professional can do some lab tests to check on your thyroid levels. They might check on your vitamins, because sometimes when people have thyroid, they have deficiencies in their body, vitamin B12, iron, vitamin D, to name at least, can cause symptoms of depression. We can ask about substance abuse. Some people, when they are depressed, they can self-medicate by using substances, or maybe because of using substances, they can feel depressed. So we'll ask about substance abuse, and we will, like I said, we'll ask about family history, because, like I said, it's mental health is genetic. Sometimes it runs in families, the depression. So we'll ask, do you have any family members that have been diagnosed with depression? And we'll talk about maybe your grandparents, your parents, your siblings, your children. So we'll ask about mental health conditions in those, history of depression, history of suicide attempts, history of completed uh, suicide. So we'll collect all this data. We'll use the diagnostic guide. uh, we'll collect all this data, and then we have 9 symptoms of depression. So for us to diagnose a patient with depression, the patient has to have 5 of those symptoms. And one of those symptoms have to be lack of interest in things that they used to enjoy. Maybe they used to go to the gym, they don't go to the gym anymore. They used to go out with friends, they don't go out with friends anymore. They don't get pleasure in things that were once pleasurable. They found those things pleasurable, now they don't enjoy doing those things. And then consistent sadness, feeling of sadness. So we have to have those. And if they have 5 of those 9 symptoms, then they meet the diagnostic criteria for depression. And then the medical professional will also ask about duration. So how long have you had these symptoms? You have to have these symptoms for 2 weeks, consistently for 2 weeks, for you to be diagnosed with depression. So we will want to know, how long have you had the symptoms? You don't have to have had the symptoms for 1 year. You don't have to have the symptoms for months. 2 weeks consistently feeling sad and having all these symptoms of depression, then we can diagnose you with depression. Something else is about functionality. We have to know these symptoms of depression, are they affecting your functionality, your normal functionality? And when I talk about functionality, I'm talking about something like school. If you're a student, it's affecting your grade. You're missing classes because of the sadness, like the lack of interest in things. You're lacking motivation to go to school. You're sleeping too much, so you're not going to school because of that. You're because of the lack of sleep. Maybe you're having problems with focusing even in class. So we want to know your functionality. Work is something else. So if you're depressed, you don't have energy, you're having issues with focus and concentration, you're not sleeping well, you're sleeping too much.